Okay, I mentioned being safe. That means, look, you got to protect yourself because the flu is running rampant. There are a lot of people getting sick.
Real.
I've seen people on my timeline say, "Hey, I spent time with the family. I did this and that, and now I'm sick."
Yeah.
Um,
Yeah.
and I look, I understand you want to spend time with your
My
friends and loved
family,
ones.
my family is like family dinner we do day after Christmas dinner.
Yeah.
Like it was like cut down to half because half of them were sick.
Everybody was sick. My a couple of members of my family, I believe it was my niece, and my brother were just getting over something. Luckily, they got over it, and we didn't catch anything. But folks are getting sick, so we got an update from doctors from Novant Health on the flu strain that's out there. What you can do to protect yourself. Some helpful tips, because just because the holidays are over doesn't mean that you're not going to catch
we're
the
in the
flu.
middle of flu season.
We're in the heart of it.
Yeah.
Kids are going to go back to school soon. You're going to go back to work.
Yep.
So you just want to make sure you're protected. So listen to this. This is from Novant Health on yesterday, giving us some big updates.
Just a few comments I'll make about influenza and respiratory virus season. And if you can't hear me, please let me know as I'm kind of managing all the technologies. It's that time of year. So respiratory virus season is here. It is typically between November and March for us in healthcare. And really during that period, we see this increase in infections from several respiratory viruses, mainly influenza, COVID, and RSV, or respiratory syncytial virus. But there are other viruses that float around as well. It's really what happens this time of year. Over the last couple of weeks, our healthcare system has seen some significant increases in influenza cases in particular in our clinics, our emergency rooms, our hospitals. And I think that trend will continue in the next few weeks as everyone is gathered for the holidays and will continue to gather around the new year, that these viruses will get spread in our communities. I can tell you over the last week over week, our hospitals and emergency departments have experienced a 2.5 times increase in positive flu cases. We're also seeing some increase in RSV, that respiratory syncytial virus, which is typically a wintertime infection. So we're not surprised by any of this. It's just every year it happens a little bit of a different time, and that's what's happening now. If you look statewide, the state of North Carolina is also seeing some increases in the respiratory virus activity in the emergency departments. That's continuing to go up. And we're seeing that nationwide. So if you look at the state of North Carolina data or CDC data, we see the same things. I'll tell you the dominant strain out there is an influenza A, which is H3N2. Influenza A is the most common flu we see each year. This one's a little bit different. It comes from a subclade called K, like the letter K. We haven't seen that one as much before. It's unclear if that strain has more severe disease, but it may be more contagious because it is the dominant strain. It's the thing that's being spread around the most in our communities. I do get asked sometimes, how do we distinguish the symptoms of the flu versus the symptoms of RSV versus the symptoms of COVID? That's hard to do, even for experienced physicians, but kind of the general rule of thumb as we think about those different viruses is when people tell me about influenza, they talk about it coming on very suddenly. They feel like they have a high fever, and they particularly have these muscle aches. And they'll describe it as, I felt like I was hit by a truck. That's the phrase you hear the most. COVID tends to come on over a little bit longer period of time, maybe a few days. You get fever, sore throat, congestion, runny nose. It doesn't have that hit by a truck feeling. So those aren't perfect descriptions, but the best way to determine what virus you have is to be tested. And there's some testing modalities out there, some testing you can do with home tests, at urgent cares, at your doctor's office. So that's the best way to distinguish the viruses. But if I had to think of them in different categories, I would describe it that way. How do we prevent all of this? How do we reduce our risk in respiratory virus season? First and foremost is vaccination. It's highly recommended. It's safe. It's very useful for respiratory viruses. Influenza is preventable. People over the age of 6 months should consider vaccination. And vaccines can prevent infections like the flu, but also reducing the severity of the flu if you do get it. They're not perfect. We know that, but they can make your infection less severe, which could be important. I'll say that we talked about about testing a second ago. Early testing for respiratory viruses is advisable if you have symptoms. If you're going to be tested, do it soon, particularly if you have risk for complications. So if you're someone with diabetes or lung disease or heart disease or cancer or immune system issues, you want to be tested and you want to do it early because treatments for flu and COVID exist, but they're better to get them started within a couple of days of your symptoms and not wait longer. Other ways to reduce your risk or help the community is stay at home when you're sick, stay home from work or school. Consider antiviral medications. Your doctor can tell you if you're a candidate for that for both flu and COVID. We tell people wash your hands, clean surfaces around you, and consider using a mask, particularly in crowded settings, to help lower your infection risk. One comment I want to make before I kind of wrap up here is, and we don't emphasize this enough, when you prevent something like the flu or COVID, it's important to do that to avoid getting the virus, but you're also avoiding the serious complications that can come on after those viral infections. And we do not talk about this enough, and we should. When people have flu and COVID, your risk in the next few weeks for heart attack, stroke, pneumonia, sepsis, all of those things go up. Because when you get those infections, those viruses cause inflammation in your body, particularly your blood vessels. And so if you're at risk of having a heart attack or a stroke or pneumonia or sepsis, that inflammation can lead to those things. So you talk to physicians and APPs and nurses that work in emergency departments this time of year, they will tell you that people come in with heart attack and stroke and pneumonia and sepsis. If you ask them, have you had a respiratory virus in the last few weeks, they will often say yes. So getting vaccinated, preventing getting these infections is not just about, hey, I'm avoiding getting the virus, I was going to get over it anyway. There are serious and sometimes fatal complications from these viruses that you're helping prevent by protecting yourself. And while those things can occur in anyone, they're particularly more likely in older adults. Again, diabetes, heart and lung disease, cancer, immune system issues, those are the things that people, and when you have those things, your risk of complications from these viruses really goes up. And lastly, I'll say there are antiviral medications for flu and COVID. For flu, some of them are just one pill, some take several days of therapy, but it's best to talk to your doctor about what the best options for you would be. And you want to do that quickly because if you're going to take those medications, as I mentioned, you want to take those within 48 hours of your symptom onset. So talk to your doctor if those are best for you. And with that, I will take any questions.
Dr. Priest, I'll kick us off. For anybody who has spent a lot of time with family at the holidays and inevitably heard so-and-so had the flu after, what is the incubation period like for influenza where you should really be on high alert?
Yeah, I would say for the next week. So that's the kind of time to think about it. And we run into those situations, right? You go to the public gathering, the family gathering, and you weren't told that so-and-so was sick, or you find out a little bit later. So you have to think about taking precautions. There are some very immunocompromised people who, when they're exposed to flu, should probably talk to their doctors about whether it would be beneficial for them to take an antiviral medication if they've had a really high risk exposure. So it's worth talking to your doctor about that.
And how are the case rate that we're seeing right now comparative to year over year? It seems like you're reading about it more every year, but I also know that we say that every year.
Yeah, I mean, in our system, in our healthcare system in North and South Carolina, what we're seeing is we're peaking a little bit earlier than we did last year. It just depends on the year. A big peak generally comes, and sometimes it's December, January, or February. I think we're peaking a little bit earlier than we have in recent years, but nothing that seems particularly out of the ordinary to us in terms of number of cases.
Great. Any of our media partners who are on, do you have questions for Dr. Priest?
I have one, Caroline. Dr. Priest, you mentioned vaccines, but we know it's a little bit late in the season. Kids have been out now for the holidays and they are returning back to schools next week and later. Is it too late to get the vaccine? What should families know as far as the timing goes?
Yeah, great question. It is not too late to get the vaccine, but I think as you're alluding to, when you get the vaccine, you're not instantly protected. It takes a couple of weeks for your immune system to respond to that vaccine. So the sooner the better. Now, I don't know when the true peak of these cases is going to come, probably in the next couple of weeks. So it is worth going ahead and getting vaccinated. It's not too late. And the peak may come later in January. And if you get vaccinated now, you can be protected. And every once in a while, we have years where we have two peaks. So sometimes later in a flu season, influenza B will show up, and the vaccine includes protection against influenza B. And so it's worth going ahead and get vaccinated. It's not too late. And the vaccine is available in your local drugstores, your physician's offices, local health departments have it, so it's worth getting.
And just for
If someone,
parents out, oh, go ahead. Go ahead.
I'm sorry. If someone has the flu, how long are they contagious?
Yeah, so it's generally for about 24 hours after their fever is gone. So it's one of those things where you watch and follow. When your fever is gone, you wait about 24 hours, and then you're no longer shedding virus or contagious. So it's really around when the fever ends and when your symptoms get better.
What have you seen ramp up so far this season to kind of contribute to the restrictions for some of these visitors? I mean, it has to be intense or more intense this year if the visitations have been restricted for certain hospitals. So like, what are some of the new ramps you've seen for this particular season?
Yeah, we actually restrict visitors almost every year, and we often do that in collaboration with other regional healthcare systems. We talk to them frequently, and the great thing about that is we all collectively really care about our communities, and we want to give consistent messaging about all of this. So it's not so much that this year is worse than others. We do this most years. We do it because, interestingly, children can often carry influenza virus, and they don't have symptoms at all, or their symptoms are really mild. And so we understand the desire that you might want to bring a child into a hospital to visit a loved one, but the hospital is full of people that are really vulnerable to flu. And we don't want our healthcare workers to get flu either. And so we kind of take this step every year to say we don't want to bring extra respiratory viruses into our hospitals. Now, there are exceptions to that in our healthcare system. So our teams will work with families. If there's a reason a child needs to come in the hospital, maybe it's an end of life issue for a loved one or a sibling visiting a new sibling after their mom's had a baby. So we will work with families to make sure those things happen. But in general, just general visitation's not great. And we just decide to do this every year as we monitor that respiratory virus activity and say, okay, now's the time. It's a little different every year, but now's the time to say, let's keep some folks out of the hospital for a few weeks just to keep people safe.
Any other questions for Dr. Priest?
When should someone who's sick with the flu go to the doctor?
Yeah, so that's a really good question. I think the first thing to know is about your own healthcare problems, right? So if you're an older adult, diabetes, heart disease, lung disease, cancer, immune system issues, you should err on the side of talking to your doctor sooner. First, you should be vaccinated against these viruses to protect you. But if you're starting to develop those symptoms, talk to your doctor. So many doctors now take electronic messages. You can call the office, you can send a message and say, hey, I have some risk factors for complications of these viruses, and I have symptoms. What do you advise me to do? And I think they'll advise you to be tested early and to go on antiviral medications if that's the right thing for you. Now, a younger person who has zero health problems, whose symptoms are mild, that's someone who is less at risk for those complications, but should certainly consider staying home from work or school and potentially get tested to make sure they're protecting those around them. Because remember, we do all this together. It's our communities trying to protect each other and protect the most vulnerable among us. And so we have to think about that as we have these infections. So just know about your own health problems and what risk you might have, and then talk to your doctor about what's best for you.
All right, so that was an update from Novant leaders, doctors, when it comes to the flu and what you need to do to make sure you're safe along with your family, your loved ones, your friends. All right, let's take a quick break. We'll be back here in just 2 minutes here on Live Impact News on WCNC Plus.